Welcome to the College Knowledge Podcast, sponsored by the College Planning Network and Paradigm Financial Group. Whether you're searching for that right fit college, applying to college, or figuring out how you're going to afford it all, you're in the right place. You'll hear from deans, admissions counselors, student athletes, and scholars from esteemed universities and colleges around the country. We'll dig deep to uncover their insight and unique experiences. So whether you're a student gearing up for college or a parent with college-bound kids, sit back, relax, and listen. Like you, we have lots of questions. Our guests have the answers, and we're excited to share them with you. Let's get started. If you didn't know, we have a free crash course on college funding at elitecollegiateplanning.com. This will explain different types of loans, types of financial aid, savings vehicles, and much more. Hey, everybody. Welcome back to College Knowledge. I'm your host, Dave Kozak, alongside my co-host, Mr. Joe Kerins.
Dave, good to see you, sir.
As always, Joe.
Did you know that the largest federal government asset is student loans? Makes up 38.6% of all government assets.
We're trying to go there that early in the morning, Joe. I mean,
Sorry.
that's insane to even think about and consider that that's it. But I did not know, and now I do, so I'm better educated for it. Moving right along, so I don't get down that pathway, we have a distinguished guest today, a rare and awesome, my favorite type of podcast, in person, in the office. We're all in the same booth talking about what we're going to talk about is nursing. And Nancy Barker, the chair of the nursing department and associate professor at Westchester University, has joined us. Nancy, welcome to the show.
Thank you so much.
So, as always, our goal is to try and educate basically the consumer about higher ed. And in this case, nursing is something that we're always in need of. It's always a sort of a, I don't want to say it's a growing environment right now because we have an aging population that we need more nurses all day, every day. So we want to educate our listeners on what does it take to be a nurse? Who's the right fit? How does it go? How does it play out? And you've got sort of a cool story to tell about how you got there. So can you give us a little background and then tell us sort of your education progression and how it came to be?
Sure. So I'm one of those individuals who sort of always knew I wanted to be a nurse.
Okay.
From back in 1970 something, there were the opportunity to be what was known as a candy striper. And I worked in a hospital as a volunteer for a little bit, decided this was it for me, went to Delaware County Community College as an associate degree nurse, went on to get my BSN at Widener University through a wonderful pathway program, then started to teach nursing for Delaware County Community College once I had my BSN as a clinical faculty member, and then got my MSN in nursing education, thought I was done, got a job as a full-time professor, and then decided, let's get my doctorate in higher education so I can really teach. So I know what I'm doing. I knew how to be a nurse, wasn't always sure how to teach. So that was incredibly beneficial. So ended up doing a lot of innovative teaching, simulation, active classroom, and really love now being a nurse educator as well as a nurse.
Awesome. And so now I have to do my mea culpa. I didn't address you as doctor, and I should have. So
I'm completely comfortable with Nancy.
Okay.
It's
All right.
perfectly
I just
fine.
want to make sure you earned it. So I want to make sure that it is. So how common is it, do you find, that students know they want to be a nurse?
I'm going to say it's about 50-50.
Okay.
I think there's students that come into the nursing program thinking, maybe this is where I want to be. And then we have those students that just know this is where they want to live and this is what I want to do, and are committed to it, have done perhaps technical high school where they've gone into some of the earlier, I want to say, immersion into health studies and just know this is it. This is where I want to be.
So, and I love the pathway you took. And Joe and I spend all of our other hours when we're not recording things focusing on the financial component of college. And so there's a lot of pressure, and there has been. And I actually just did a post on Instagram yesterday talking about the pressure through the 80s and 90s where everybody had to go to college. Everybody had to go to a 4-year degree, and you had to get it or you weren't going to be successful. And we're seeing a backlash on that right now. from the people that were pushed to go that aren't earning what they want to earn or aren't doing what they want to do. And so your pathway for someone that knows is an incredibly intelligent pathway in the nursing model. And I don't want to cause issues here, right? I'm in full support of education, but if you go, let's use Drexel as the example today. A nursing degree straight 4-year out of Drexel is $80,000 a year. It's the last I saw was 82.5, and and that was probably last year, the last time we sent a student to Drexel. It's probably up a couple grand from there. But you chose the path of Delaware County Community College to get the first degree necessary. And then again, you're all the way through your doctorate. So it's not like you got gypped on education, but you certainly did it efficiently.
And I think that is the beauty of nursing specifically. You really can. So I am from Westchester University, so I know Westchester University's pathway. We have a traditional 4-year degree, which does not cost $80,000 a year. Push it to
Truth.
$7,500 if you don't live there. We also have a concurrent program, so you can attend Delaware County Community College and Westchester University, but you're going to pay about half the price because you're going to get your first degree really from Delco, but you're going to finish in the same amount of time as if you were just doing your associate. And then we also have an RN to BSN, which is what I did. So I started out at Delaware County. I got my associate degree, got a job at a hospital. The hospital was lovely enough to pick up my Widener University degree.
Awesome.
So I had no real out of pocket until I got to my master's, which ironically was at Drexel University.
Yep. And listen, I'm not dogging any of these schools.
No, they're all great.
Drexel's a fantastic institution. It's just its price tag, its sticker price, as we call it, is 80 plus. So it's and that's today's price. So we won't talk about what it cost back then because I'm not 100% sure in 2010 what Drexel cost, but it wasn't cheap by any standards. So how many people specifically at Westchester are in that sort of dual enrollment environment where they're starting at Delco and they're what's the word I'm looking for?
Transferring?
Yeah, but no, it's not necessarily a transfer. It's like a direct entry, right? How many people are in that path versus the 4-year path?
So we have currently about 400 students total in our undergraduate. So say somewhere between 75 to 100. Our higher numbers are in our freshman, sophomore, and those are the kids that come in. I think I want to do this, and then they go into a different. Then we have our concurrent program. So you're at Delaware County Community College and you're at Westchester doing your BSN online. We have about 100 students.
Okay.
It is a newer program. We started it within the last 3 to 4 years. It has been incredibly successful. And then we have our RN to BSN, and we currently have about 400 students in our RN to BSN, which is completely online. So come into Westchester, have an RN degree, have an associate, and then complete their BSN in anywhere from 18 months to 2 years.
So let's talk about that because that's a giant shift in education that was forced by COVID to some degree. And I would not have thought that nursing as a hands-on sort of occupation would have that type of environment. So what have you guys done to innovate to make that environment sort of complete?
I think for our traditional undergrads, we are boots on the ground.
Yep.
We're in the classroom, we're in the simulation lab, we're doing hands-on. For our RN to BSN students that have a registered nurse associate degree, we can take their learning and we can make it live through all types of interactive modalities. So we have Flipgrid discussion boards, which allow people to sort of show their face and have emotion. It's not just the written word. We have simulations and avatars that we put out into these discussion boards. We have students participating in simulations online through various products. So we can really take that learning and make it much more accessible and reasonable for someone who's working 30, 40, 50, 60 hours.
Yeah, which is awesome.
You mentioned the nursing shortage. It's real. It's pretty significant right now. So if we can help nurses finish their degree, and we know based on literature, having your BSN is great. We want to try to support that in any way we can.
Well, and I think a cool thing to sort of compare it to other majors, right? one of the things I've always said is I went to Franklin Marshall. I got a great education. It was a pain in the butt school. But it gave me the basis. But my real business knowledge started when I started in business, right? You learn all this stuff in motion, right? So theory's great. It helps you process. The training is great. But when you get to the, bedside, you're dealing with a human, and there's a different learning that happens in that real experience. So I think the idea here is let's get them to the point where they can really start to become the experts, right?
And one of the things that within the nursing world that we've started to shift is what we call clinical judgment, clinical reasoning. We have people at the bedside that we want to be able to recognize a patient in distress or trending vital signs that sort of indicate this is happening. And we weren't seeing that necessarily, or our clinical partners were telling us, we're not seeing this in our grads. So we had to really start to think about how do we teach and how do we do this better? So that, to your point, people aren't just learning that Florence Nightingale did hand washing and was, made things safer during the Crimean War. But we actually know that these students can go in a high technology environment and function. So they can operate an IV pump, but they can also recognize this person who's about ready to code.
That's awesome. So let's sort of step back to the pathway to nursing. You knew early that was your goal. What type of indicators presented to you that made you know?
I think based on who I was, I wanted to help people. And I will tell you that is still true for probably 99% of people that come in and we say, why do you want to be a nurse? Tell us why you're here. Most people will say, I like helping people. It's a helping profession. You're at the bedside with the patients the majority of time, the most amount of time than the healthcare provider or the respiratory therapist. So I think helping people and liking to be around people is sort of a good personality set to have. The other thing I encourage people to do, we have a health career summer academy that's free at Westchester. You can come in and have exposure to respiratory therapy, nursing, physician assistant, pre-PT, communicative speech, nutrition, so that you may want to be in the health sciences, but maybe bedside nursing isn't it. But you love science and medicine. That's a great place to start that investigation. Volunteering. Many of our healthcare facilities have opportunities to be a volunteer. Go in and see if you like the environment, if you like the culture.
What are some of the biggest, I think I'll say, things that go unexpected for students? What kind of deters them away that you see that maybe they thought, I want to help people, but then when they start taking the steps in the process, they go, oh, this isn't what I thought this was?
I think some students just decide, I don't know if I can do this.
Okay.
You go into an environment where people may be having the worst day of their life, a catastrophic diagnosis for a pediatric patient, or you experience someone's end of life. That's traumatic. So for some people, it's just not where I feel comfortable being. And that's reasonable. I think sometimes people get into nursing and it's academically rigorous. You go to Westchester, Drexel, Penn, Immaculata. It's a rigorous program. It's academically challenging. And you have an exam at the end of those, 4 years or 2 years that you have to pass. So you have to be a safe practitioner. So we have to see you operate clinically, but you also need to pass a nationally normed exam that says that you're safe to do that. So I think for some people, it's the rigor and the demand is a little too high.
Okay.
I mean, you bring that up. Just thinking through those just a couple of moments you offered, like there's a resiliency that has to exist in that, because seeing that consistently could really make you sad, and so you have to have that sort of mentality where you're doing everything you can to make them comfortable, to care for them, take care of them. And that in itself has to be the reward, because there's going to be the bad days that are really bad.
I think what we're seeing in nursing right now is we're seeing a really tumultuous environment where there's a lot of stress. There's, financial stress, emotional stress, anxiety. There's never been more, a higher level of anxiety. So dealing with that on a day-to-day, and then put into that mix, you have a patient who unexpectedly codes and passes away, and you've gotten to know the family and the patient, and you have to take that home.
Mhm.
I tell my kids all the time, I know I've seen things that people are not supposed to see. Like, I know I've experienced things that people are not supposed to experience. But I think one of the rewarding parts about being a nurse is that even in those really sad moments, you can make a difference.
Mhm.
You can make the difference between a family saying goodbye to a loved one in a really peaceful, calm situation versus, the alternative.
Yeah.
So talk through, just for the knowledge, the education, the types of classes, the curriculum you're going to follow to get this degree and to be prepared, as you put it, right, to go.
Sure. So you're going to do at Westchester, you're going to do your gen eds, right? You're going to do your English, your lit, your history, philosophies, because we do appreciate the well-rounded individual. Statistics is your math. So I always tell students it's not math heavy, but it is statistics, which
Can be painful.
can be hard to do.
Yep.
There's some chem and some bio. When we have accepted students stay at Westchester, I always tell students, you really dislike the sciences, this is not the program for you. We do A&P 1 and 2. We have a micro. I always loved sciences. I loved unpacking how things work. What does the liver do? So if you're inquisitive, you'll enjoy it. And then once you get into your nursing, you're in your nursing. It is geriatrics, fundamentals. You learn a little bit about Florence Nightingale, some of the nursing theorists, but then you're really moving and shaking. So acute med surg nursing. You're at the bedside, you're caring for individuals, giving medications, hanging IVs, working alongside the nurses on the floor, which, you have to learn how to potentially navigate stressful situations. Pediatrics and obstetrics. So you get to see a baby born and get to deal with, we currently are at Nemours. And then a little bit of psychiatric nursing. So we do a couple inpatient facilities. And then your acute care med surge. And during all of that coursework, which is content heavy and exam heavy, you are also doing clinical for 12 hours once a week. So you're in classes on Monday, Wednesday, you're in clinicals on Tuesday, Thursday. And then you still may be taking alongside of that your art course or, your humanities. So that's also still a little bit in the workload. So it's you're
Intense.
busy.
Yeah.
And a lot of our students work. They either work as nurse externs or they work as patient care techs or they're babysitting, to help pay for textbooks or or gas. So that's, the other part of it. But it is academically, like, it's rigorous and students work really hard in nursing. And I think that's true of every nursing program.
Yeah. I did want to take a step back because I know there was some letters that you threw out, RN, BSN, maybe not all of our families, maybe they're sophomore, they haven't researched yet. What are those different letters, meanings, degrees, pathways? Just kind of clarify some of that for our listeners.
Associate degree in nursing is a 2-year nursing degree. You can sit for the state board, so you're a registered nurse. A bachelor's in the science of nursing is a BSN. That is a traditional 4-year degree. And then we have sort of these newer programs that are coming out across a lot of our schools. The concurrent program at Delaware County Community College, where you get your associate degree from Delaware County Community College. And while you're doing that in your clinicals and your coursework, you're also taking classes at Westchester to get your BSN.
Okay.
So things like leadership, ethics. And then there's a master's in science of nursing, nurse practitioners, but that is all above and beyond that RN, BSN degree.
So the 4-year degree is the BSN.
Yeah.
And the 2-year essentially is the RN.
Yep.
Assuming you pass the test.
And that's the other key point. If I don't say this, I will feel a horrible person. When you're out looking at nursing programs, the one question I tell everyone to ask is, what is your NCLEX pass rate? That's a really important question. You want to finish school as a safe practitioner, but you also want to get your registered nurse. You want to get that license, because if you don't, the BSN really does nothing for you. So ask what the NCLEX pass rate is.
Okay.
And I assume the NCLEX is the exam.
It's the state board. Yeah.
And is that different at every state or is that national?
So it's the NCSBN is sort of that governing body.
Okay.
There are compact states. So if you get a license in Pennsylvania, it's reciprocal in about 30 other states, which is phenomenal. But you definitely want to know what the pass rate is.
And so, as I always have to press on the RN to BSN, right? If you get an RN and you pass the test, is there a substantial increase in wage, salary, or opportunity when you get the BSN? And is there holdbacks, or is there? And again, this is more getting to the system of healthcare, whereas like you have to have this degree to get to pediatrics, or you have to have this degree to be a specialist for. Like, can you walk through that a little bit?
Yeah, it's a great question, and I will tell you, in the 1980s, when I was finishing up my nursing degree, the push was you had to have a BSN. It was coming in 10 years. If you didn't have it, you weren't going to be able to be a nurse. Well, here we are in 2024. And you can be a nurse with an associate degree. However, if you want to work in acute care hospital, you probably need your 4-year degree.
Okay.
Where you see most associate degree RNs working is long-term care in mental health, as well as sometimes in our rehab facilities.
Mm-hmm.
Where you see acute care nurses such as critical care, pediatrics, pneumos, CHOP, probably more BSN focused. So where you will work,
Mm-hmm.
and that certainly will be reflective in probably your salary.
And so then, excuse me. Last question on that sort of is like, so you go to your local doctor. Is an RN good enough to be a nurse at a doctor's office?
Absolutely.
Got it. Okay.
Yeah. They've done the same core work to sit for that licensure, what we call a generalist nurse. So can kind of work in a lot of different environments. The difference is the additional course load that comes with a BSN really has to do more with the leadership and some of the research-based knowledge that is needed.
Okay. So you got?
No, good.
So good friend of mine, my roommate for college, is a anesthesiologist, and he went F&M, then he went to Jefferson, and after Jefferson, he went to Yale New Haven Hospital for residency, and then he went to Stanford's hospital for his fellowship. And I guess the question, I say all that to ask the question, to be a specialist, right? To be an operating room nurse, or to be a, brain surgery nurse, whatever it is, are there, like, is it a matter of RN, BSN, then residency, then like time like that? Or is it you just become, you're good and they recruit you?
So I will tell you, one of the biggest things I tell students when they're doing their clinical is you're on one big job interview. So if you're doing your clinical, say at Chester County Hospital, and you want to work in the ICU, you're there and people are observing and are watching how you interact. That can help you get in that door for that position. Currently, based on the nursing shortage, it is a little bit easier to get those spots.
Okay.
So 30 years ago, when I was coming out of nursing school, I had to do med surg and then transition into critical care and then do specialty, versus you can sort of go into an ER or an ICU. So if that's what you want to do, and some people just know, I want the high paced, I want the craziness of an emergency room. You can do that, and you can really do that with an associate degree or with a 4-year degree. It depends on the institution. And every nursing student that I speak to somewhere in junior to senior year, I have that conversation with them. Go get an internship, go become a patient care tech. See if you like the culture of the hospital, if this is where you feel like you're a good fit. Because a lot of students will come in and say, I know I want to do pediatrics. And then they do their pediatric rotation and they're like, I absolutely do not want to do pediatrics.
Yeah. So, dear friend of mine, almost my second mother growing up, was a nurse for 40 years at Chester County Hospital. And she was the Da Vinci robot.
Oh, yeah.
Person. Like she would, that, which my understanding is like, that's top echelon.
Yeah.
Is it learn on the job, perform, get the next opportunity, learn that, perform, and is it step up like that? Or is there a direct pathway to, hey, I want to run the Da Vinci robot and do heart surgery?
I think it's opportunity presenting itself.
Okay.
I had a similar experience. I worked in a burn center. They were just coming out with cultured epithelial autografts, which were grafts that they kind of grew from a little tiny speck of your skin. And there were nurses that became sort of that person, that specialist in relation to that. So I think it's if you find your niche, where is it that you want to be, and you get fulfillment and you enjoy it. I think that's where you end up. For some people, they absolutely positively love geriatrics and going into people's homes. For other people, it is what I call the craziness of the ER. I don't know what's coming in, who I'm going to see next. And I enjoy that. And that was, for me, I was always like, that's nerve-wracking.
If you didn't know, we're on Instagram, Facebook, Twitter, and LinkedIn at Elite Collegiate Planning. Make sure to share and tag us. Yeah, no doubt.
So to now look back at the, from a student perspective, they're a high school junior, right? Because most seniors this time of the year are, I think, more a little bit kind of know where they want to go. We'll say, or they've sent out their applications.
Right.
When you have a student that is interested in nursing and they're building a school list, what should you mentioned one piece, like what is the pass rate, right? Definitely a big piece, but what are some other things that they should look for in institutions, specifically a nursing program that maybe is different from school to school?
I think there's some things that can be dramatically different. I would always ask to see, can I see your simulation center? Our simulation center, when you walk in, people are like, wow, this really looks like a hospital. I'm like, that was the point.
Yeah.
We want our students to come in and go into an exam room and feel like they're in an exam room. Or if we run a code, we want it to look like it's chaotic in a code.
Yeah.
So I think you want to see, where are my classes? Where is the simulation center? How much time do I spend in clinical? Where are my clinicals? There's certainly some other questions you want to ask in relation to class size. I tell students when they come on accepted student stay, if you don't want your nursing faculty to know who you are, don't come to Westchester. Because if you don't come to class, I'm going to email you and say, hi, I noticed you weren't in class. Whereas in other schools where, maybe it's a class size of 150, 300, they're not going to know that. So where do you fit?
Yeah.
And I sometimes encourage parents, like, listen to where your child feels like they fit, because they usually know this is where I want to be. But I think certainly asking about class ratio sizes, what are the support services? All my freshman, sophomore nursing students, I advise to get a tutor for Bio 259269, even if they don't think they're going to need it. So we have that. We have those resources on campus to support our students.
Yeah.
What do those services look like? I think those are really important questions to ask.
Yeah. Another one I have, just real quick, because I know this is one that gets asked a lot of parents on me that have kids that are interested in nursing, is direct entry programs. Because I know there's some schools that have it, not all schools do. What exactly is that, and what does it lead to? What is the opportunity that's different with a direct entry program?
I actually get that question a lot. Parents will always say, like, do they come in right as nursing? So some schools have pre-nursing, where you have to have certain grades and you don't get accepted into the nursing until perhaps your sophomore year.
Okay.
So it is based on usually science grades and GPA. Most of the nursing schools, I think, in the tri-state area are direct admit. There are a few that are not. At Westchester, if you apply to nursing and you get into nursing, you're in nursing. We also have science requirements, and sometimes students don't hit it. And we tell them, you're not out of nursing. You just have to retake and get a little stronger in perhaps A&P2. And then you come right back into nursing. So we don't, kick you out. But there are certain things that we know the sciences and reading comprehension are incredibly important to the success of nursing students. So we look at those things as being heavily weighted in how someone will do.
Yeah, I'm taking a guess here, but A&P is anatomy and physiology.
Correct. Yeah.
Business major. Come on. So I guess the point that I took from that, and I want to ask and comment, is like nursing is one of these majors where, it's not all philosophy. So you don't just get to go read books in the corner by yourself, skip class and not show up. Like, you've got to learn. All the book stuff is there, but then you have all this practical applicable stuff you have to take care of. And so if you're into like not going to class,
oh, nursing's not for you.
Yeah.
Yeah, nursing's not for you. You have to show up for clinical. I tell students, I teach nursing fundamentals, which is the very first nursing course students get. And I say to them, listen, when this course is done, it's not like check it off, I'm done, I can forget it, because all of it comes back. So we teach you about fluid and electrolytes, and you're going to see that in junior year and senior year and well, when you graduate. So it's one of those things that it's foundational, right? So it's scaffolding,
Mhm.
it builds upon, and the stronger you are in that first, nursing course, the better you will be throughout. But we are highly exam heavy. We have a lot of exams in nursing.
I got the question I wanted to ask poignantly here. So I sort of went through the anesthesiology and what it took for him. I mean, he was 34 when he got his first job, but in schoolwork, in that BSN program, senior year, are you able to take specialized type classes?
Yes, I love this question. So we actually have a critical care elective course at Westchester. So if you know that you want to do critical care, we have a peri-op elective. We have an elective that you can take if you think you want to work with specialized populations. So there are avenues that you can go. You can also get experiences during clinical. So you can go to the OR, you can sit in the ER and work alongside to see, ooh, is this, this sort of where I want to be, where I want to be. The other thing I want to say is when you get your 4-year BSN, you can keep going and get your nurse practitioner
Mm.
so that you can become very specialized in psychiatric nursing or nurse anesthetist or pediatric, where you're working alongside medical doctors as a healthcare provider. So it's sort of shifting that role from perhaps bedside nurse to more, um, caring for the patients one-on-one.
And so is that the pathway that someone takes if they really want to get to be the expert of a particular?
Absolutely.
Got it. So
And I,
that's
and I would always encourage people, live in nursing 2 to 3 years, see if you like where you live,
Mhm.
and then make that investment, because it's about 600 clinical hours and 2 to 3 more years of school.
and follow up as always to the money.
Mm.
Are there a lot of healthcare systems that are aiding in that? If you go work for 2 years and you're like, no, I want to do this, will they help you?
Yes, there is a lot of tuition assistance being offered at all the clinical institutions that we partner with. So, absolutely.
Yeah, and the reason I say that is because we have to think, and this goes back to economics, right? Supply and demand, simple supply and demand. And Pennsylvania historically in their TAP program has always, nursing's one of those things that have come on and off where they're like, hey, we need them, throw money at it. Oh, we're good. And they pull money back. But the idea for anyone listening, if this is a thing that you think, hey, it might be for me, you have to realize when there's a shortage, there's money in that shortage
Mhm.
every which way. And so pay attention to what's happening. We're, from a generational standpoint, the baby boomers are aging. And so if geriatric nursing is something that you're into, I mean, you've got a runway that is going to be for the next 30 years and that is going to be an increasing effort and opportunity.
I think nursing is a lucrative career. I think you can definitely make a nice living from nursing. I also think that you are employable from about 50 different directions,
Yeah.
from informatics to bedside to sales. I mean, there's so many different directions that you can go.
Mhm.
And that's a cool segue to the MBA model, which is interesting to think about too. Nursing degree to MBA. Maybe not initially. You go do your bedside. You realize that, well, hey, I'm not really the hospital type nurse, but I know all this stuff and I'm good at it and I can communicate well. You get an MBA and maybe you don't even need the MBA, but you can work for these companies that provide the equipment and the technology and the stuff too. And you can explain it. You can talk the lingo of the nurses and the doctors.
Oh,
and you're providing, and that could be very lucrative as well.
there's legal nurse consultant. So you can go and get a certificate so that you are also doing that. I mean, I think the possibilities are honestly and truly endless. And I think for a lot of us, myself included, I did bedside nursing for fairly long time. And then I was a home care nurse for another 14 years. And I currently still work clinically for Chester County. So it's one of those things where I've never totally left nursing, but I've done a lot of other things in between.
Mm-hmm.
Yeah, including teach it, right?
Exactly.
Which is obviously something you're passionate about. You can just, when you talk about it, you can tell. So,
I love what I do. I really do.
And it comes through in the communication and the explanation. So for the parents that are, I don't know if it's for you, I don't know if like it's the right play, or, I don't think you're cut out for that. Talk to the parents a little bit about like, and I think obviously everything we've said is getting there, but quell the parents' fear of a child going into nursing, or you're not strong in science. And,
I think people can become strong in science. I do think you can get there. I think one of the things that is important to recognize is if you do get into nursing and in your sophomore or second semester, you decide, I don't think this is for me, there's about 17 other pathways in the health sciences you can take. You can do pre-PT, you can do respiratory therapy, nutrition. And it's not necessarily like, oh, I've wasted all this time. I think a lot of people figure out in their first clinical, this isn't for me. But if your child is really passionate about it and this is what they want to do, they'll figure out the sciences.
Mm-hmm.
They really will.
So I don't want to say controversial question, but one that, again, parents bring to me. You mentioned a few different schools that have nursing programs. We obviously have Westchester, and you mentioned Penn, right? And I know parents look at it and say, well, if they go to Penn, they're going to have a better career.
Mm.
That's how they justify some type of, oh, well, it's 5 times the amount of money I'm going to spend on that education, but it's worth it. There are many different areas of, if I'm going to be an attorney, does where I go to undergrad matter? Does law school matter? Like, does where you get your undergrad degree help you get into other schools? Is nursing, does that hold any weight that where you actually go to school can dictate the type of job that you get or future education that you may be pursuing?
Thank you for this question. I think I'm going to say that our partners at University of Penn provide an excellent nursing education. That being said, Westchester University has somewhere in the ballpark of 1,000 applications for our nursing program. We have 75 to 100 seats.
Mhm.
So nursing is just really competitive right now.
Sure.
Everywhere.
Yeah.
Small private institutions, large public institutions. I think for me, for nursing, wanting to go into nursing, I would encourage students to pick, here are the 5 places that I want to go and apply. And the decision may be made on, this is where I got in.
Mhm.
And I mean that in the nice, this it's so competitive right now. Do I think a 4-year degree student coming out of Westchester is going to look dramatically different on a nursing floor? I don't. I think that we produce a very quality student or product. Do I think it'll change where you can work or where you can become a nurse practitioner? No, I don't. I think if you want to be a nurse practitioner and go back and get your degree at Penn, you can probably do that off of, the diving board of Westchester. I think you can kind of get where you want to go.
And again, I'll go back to supply and demand. Like, we need nurses. And so if you're going down that pathway, like, table set, all you got to do is perform. And I want to answer this because this happens in all majors. My kid needs to be an engineer. Engineers are the only ones that can be successful in life, and they make everything happen, or got to be a lawyer or whatever. It comes down to the student in the box and the performance when they get there, right? So for all the students listening, whatever your passion is, awesome, pursue it. But once you get the degree that you pursued, it's what you do with it. It's not the launch point. It's the end point. It's the learning you do, right? What I've always said about education, what it really should be about is teaching you how to learn and consistently learn and learn for a lifetime. Because as you've experienced probably since you started, technology is a little bit different today than it was. And we have better tools, we have better systems. And so it's not like you get the degree in nursing and, I know everything I need to know. That's the launch point. And then in an ever evolving healthcare system, society, and technology platform, like, you got to stay with it. So it's that person that has to do it.
I think to your point, the other thing that's really important is it's what you make of the environment you're in. So if you decide to come to Westchester's nursing program and you decide, I really want to try and, investigate this or look at research, we'll support that.
Mhm.
And so I think it's what you make of where you are, right? Anything can be a fantastic situation and anything can be miserable depending on, how you roll with it.
Yeah, it's funny too, because I had this conversation I coach a 12-year-old travel softball team. And I said, you can control your attitude and your effort, right? That's what you can control. You
Yep.
can't control the umpire or anything else. And it's the same thing in education. Like you can control your attitude, your effort, and what you put into it. And what you put into it is what you'll get out of it. So you can't blame the teacher. The class is hard. I can't
No,
get the tutor, go for it.
we've had nursing students that have graduated and gotten these highly, desirable positions that we are so proud of them for. But, they did the work.
Yeah, 100%. Any just blanket advice you give to students considering nursing or families that are looking into nursing programs?
I would talk, if you have the opportunity to go on campus and meet with the students, talk to the nursing students and ask them, what's your program like? What do you love about it? What do you not like about it? What's the hardest thing? Certainly walk around the campus and see how you feel about the campus. And there's something for everyone. I like to say this about Westchester all the time, but you'll find your people at Westchester. Like it's a pretty diverse campus. So certainly make sure that you're a fit for the school and that the school is a fit for you, but ask lots of questions. And if someone doesn't want to answer your questions,
Yeah.
that may be the big
There's
red
some
flag.
information you got right
Yeah.
there. Well, and I think your point about people get very concerned about college, where they're going, and are they going to fit in, and is it the right? We say this, I mean, almost on every conversation we've had. Your people are there. You can find them. It's at most schools you can find them, and so like just make sure that time you go visit, you see and you feel it, and hey, I could be here. I could do this. This is the type of place I get used to, right?
And allow your children a little uncomfortableness.
Oh yeah,
They are not going to love it, most of them, right out of the gate. There's going to be a little uncomfortable. I'm sitting by myself and I have to eat, or I can't find a classroom. Let them navigate. Give them some time to get comfortable, and they'll find their way. Most of them.
one question we ask everybody, and it's been invaluable in my life, but it's mentors. And one of the things that got me to the level of success we have here is I stand on the shoulder of giants that taught me everything I know and pushed me in a certain direction and said, this might be for you, go here. How much did mentoring come into your life? And then how much mentoring do you guys do in the program to help people get to where their ultimate goal is?
I think nursing on a good day, on a really good day, is standing on the shoulders of giants. I know that even just being in education, I had people that taught me that said, you should think about this. And that's all I really needed. I think for our nursing students, sometimes taking a pause and saying to them, this is okay. I tell students when we're in the simulation lab, listen, if you're going to kill somebody, I want you to do it here. I want you to do it well. Do it all the way. Because when you leave here and you go out and take care of people, you're going to remember this.
Sure.
But this doesn't make you a bad nurse. This is just the wrong move. And I think that's what students really need to hear right now, that how you get there sometimes is through some mistakes, but prefer you do it in the lab, not in the hospital. And we have a lot of our senior nursing students that are fantastic. I could rattle off. We have a current senior that is tutoring a couple of our junior nursing students that are really having a bit of a time in one of their pharmacology classes. And to see that and the support that they give and how they will meet with them outside of those normal tutoring times, it's fantastic. And
Yeah.
that's what you want to see, that community. And that's one of the things that I think in our nursing program at Westchester, I do think we really do have that.
That's awesome. And the reason I bring it up and the reason because it's just reality, right? It's network. It's people have this perception of networking as though it's like, oh my God, it's the awkward thing you have to go do at a business mixer. It's not. It's every interaction you have. It's every opportunity that may be created. It's every question you ask. It's like, and I think, again, to encourage students, man, ask the question, have more questions than answers. And if you lead it with more questions than answers in a pursuit of nursing or doctor, businessman, whatever it is, you're going to find the people that are out there to help guide you and help you. And like people that have done it can tell you, hey, maybe not, maybe so.
We have presenters that come. We have an annual research day, Mary Klein, and we have people that come and present, and our students have gone up and talked to the presenters. And then the next thing we know, these students are then working with these presenters.
Yep.
And we're like, that's amazing. Or again, you're doing your clinical rotation and you end up getting this coveted spot because you had conversations and asked a lot of questions about what you were doing. And people appreciate that.
Well, and it's odd enough, and I think this is a missing link, is people judge your intelligence by the questions you ask. They don't judge it by what you say. It's the intuitive nature of your curiosity. And so be curious, and it's okay to be uncomfortable when you're being curious, right?
It's also really great to admit that you don't. I say to students all the time, know what you don't know. If you don't know how to do this, don't fake it till you make it. Not in nursing.
No.
Come and get me, and I'm going to show you how to do it. But if you don't know how to do it, just say, I'm not sure, or I haven't done this in a while. And I tell the students, it happens to me all the time. If I'm going out to see a patient and they have a device that I haven't touched in a while, I'm going to go look that up to see, how do we do that?
Yeah. Awesome stuff. This has been incredible. I think we'll end it there unless Joe, you have any final thoughts?
This was great. I love all the education you brought to us today. Right. And I think some of the advice that you had, especially the questions that you ask when you're on campus, is extremely valuable. So if you have students that are interested in nursing and you're building that school list, listen to this episode and what were those questions that you should be asking, not just while you're there, but also asking yourself to really find out what schools are that fit, because it is competitive. So you want to, as you said, apply to those schools that truly are a fit, because it may be, there's 5 or 6 schools that I said, these are the ones that answered all those questions. It's what exactly I'm looking for, but you might only get into one and that's it. That's your decision, right? But unless you do the work and the research to find those schools that are a fit, may not be the outcome you want.
Yeah. More than one choice is always, I think, a wise choice with nursing. And then just my final plug, the Health Career Academy at Westchester University is on our homepage. We have lots of free summer camps, if people aren't aware of this, at Westchester. And it's a great camp because the students, we usually recommend sophomore, juniors, but we have seniors too. Come through, you'll meet. I've had more students come in and say, I want to be a nurse. And then when they leave, they're like, I think I'm going to apply for a physician's assistant. And I'm like, what? But it's great because you get some immersion and you can kind of see what's the life like of someone interested in the health sciences.
Yeah. And just to piggyback that, like, you can't get experience by not taking experience. Like it takes what it takes. And so to know and to have the free opportunities, engage, just engage, go check it out. It's not a pathway you want to go down and understand it's not for me when you've already got the degree. Right. So I think that's awesome. And obviously if this doesn't prove Westchester should be on the list, I mean, I concur. It's local. I love it.
It's local. And sometimes people want to, experience South Carolina, and I get that. But if you want a quality nursing program, honestly and truly, not just because I teach there, but our pass rate is about 98% and we have quality students. So come check us out.
If I had a mic to drop, I would. All right. Dr. Nancy Baker, thank you.
You're very
Barker,
welcome.
Sorry.
No worries.
I botched it. Dr. Nancy Barker, thank you.
You're very welcome. Thanks for having me.
Cool.
We can send your student to the school of their dreams and send you to your dream retirement. Visit us at elitecollegiateplanning.com to get started. Thanks for listening to the College Knowledge Podcast with your hosts, Dave Kozak and Joe Kerins. We hope you enjoyed this week's exploration of higher education, sponsored by the College Planning Network and Paradigm Financial Group. That's all for this episode. See you next time.